the last and arguably the most important thing to talk about is gum health. And the way I present this is I ask if the patient has a dog.
No.
Have you ever had a dog?
When I was little.
What was your dog's name?
Jazzy.
Jazzy? What kind of dog was Jazzy?
She was a Havanese.
Havanese? I never heard of a Havanese.
They're really cute. They're like this big and they're like white and fluffy.
Okay. So a Havanese had a water bowl.
Yes.
And if you didn't clean it all the time, it got slimy.
Yeah.
And that's what I want you to visualize as growing on your teeth every day is Jazzy's dog bowl film. And you've got to get it off. And it's not that easy to get off, okay? I like to start that process with electric toothbrush. I like the Oral-B the best. I like the ones with the little yellow bristles here. You can go to Costco and get a 10-pack of heads for 40 bucks. You change them every month, okay? You punch it. They run in 30-second increments, interrupting every 30 seconds for a total of 2 minutes of toothbrushing. So 30 seconds outside, inside, outside, inside, or 30 seconds a corner, whatever you want to do. 2 minutes twice a day. Think of your tooth as a castle. You're cleaning the north, south, and top of the castle. What do castles have around them in medieval Europe? A ditch with a water in it. It's called
oh my God.
a moat.
Yeah, I couldn't think of it.
Okay, I know. Pressure. So we were measuring your moat space a minute ago, and we want it to be 1, 2, or 3 millimeters and not bleed.
Okay.
And you had a lot of 2s and 3s and 1s. You had a couple 4s, and you had some bleeding.
Okay.
So you need to clean that moat space with a moat brush. Here, Tara.
I have one, but it's like a wider, like.
Yeah, well, we're going to go over that right now.
Okay.
So as we look, give her a mirror, please.
Sure. Here you go. Do you like to hold this? Thank you.
Moat brush.
Right here.
So this is a moat brush, okay? It's designed to be used at a 45-degree angle to the junction of the tooth and gum. And the way that that looks and feels, we're going to see how it blanches that gum tissue. Let's do it up here. See how it blanches that gum tissue white when we slide it up underneath the gum line? Okay. And that's not bad. That's not bleeding too much there. I suspect if we went up here a little bit, we might get a little bit more bleeding. Got a little bit of bleeding there, not much. If you bleed, it's because Jazzy's dog bowl film on the side of that castle has produced enzymes that have dissolved the skin lining next to the tooth. So if I pull that gum back and look, I'd find a little ulcer on the inside of that gum lining.
Okay.
And that's what you've got to heal. You've got to get skin on the inside of that gum lining. You can't have an ulcer, okay? So we've cleaned the north and south ends of the castle. On the east and west ends, we're going to floss. And when we floss, we're going to shine shoes, flip the gum back and forth. We want to see if you've got bleeding or no bleeding. And for the most part, you're not really bleeding too much, just a little bit, okay? So, good. So I'm going to give you like an 80, 88 on your grade today.
That's a good start.
Now, we've taken Jazzy's dog bowl film and we've loosened the film and we have a big scummy mess floating in the bowl. Let's see if you get the next question right. What's the next thing you do with the bowl? You got a big scummy mess floating in the bowl. What do you do?
Throw it out.
You rinse it out.
Yeah.
Okay, good. So you have to rinse it out. So, Terry,
Yes.
we use a water pick. I like the water pick brand. You're going to fill it up with water. You're going to stick it in your mouth first, turn it on, and you're going to trace the neck of this thing over the sink around the neck of your tooth. Can I have a cotton plier, please, Terry?
Sure. Of course.
Here you go, Terry. And the way that that looks and feels, you're just going to go around the neck of the tooth, inside and out, over the sink, and you'll be surprised what comes out of there. That is a key to good dental hygiene long term. And if you'll do that, you'll have excellent dental care. The buildup that you see on the backs of your teeth right here, if that film is on there for more than 24 hours, the calcium in your saliva plates out and makes that hard deposit called calculus. So that is the key. And like I said, genetically superior. You're a high B student. I know you could do A work. So
I got you.
let's work on that.
Okay.
Small, minuscule cavities, wisdom teeth, it's time. That's about it. All right? Any questions?
Sounds
Okay,
good.
good.